This segment of Delmarva Life is brought to you by Peninsula Home Care.
Okay, so we want to set up a scene for you. You've been in the hospital and the day you've been waiting for is finally here. You get to go home. You're excited, but a little nervous. How will you get to your follow-up appointments? What about the cost of your medications? Well, rest easy knowing you're not on your own. There's a team of people who can help you navigate the transition process and get what you need to continue to recover at home. They are medical social workers, or as some may call them, guardian angels. Here to explain our Peninsula Home Care medical social worker Jamie Truitt and PRMC social work supervisor and patient care management Sherry Johnson. Ladies, thank you both for being here this afternoon. Now, Jamie, uncertainty of course can be stressful when coming home from the hospital. What resources do you have to help people recover once they get home?
Well, we can help connect folks with counseling, in-home support, such as our physical therapy, occupational therapy, nursing, social workers like myself, our home health aides. And we really work with the patient to help them identify what they need and how they want to recover while at home. And then we start putting all of those services in place.
And Sherry, this process really starts before they're discharged from the hospital, right?
Actually, it starts when they're first admitted onto one of our floors. That way we have the time we need to really listen to our patients and find out exactly what it is that they're going to need when they get home. And then we have the time and ability to find the resources in the community or within their families that we can make sure that everything is in place for them when they get home so they can continue to recover and be safe and stay healthy.
Stay healthy, very important. So Jamie, where in this process do you come in?
Ooh, it could be a variety of different phases. We learn when patients are being discharged through our liaisons that work closely with the hospital staff. And sometimes I'm there day one, week one when a patient comes home, or it could be in a couple weeks, or even at the end before home health leaves them. It just depends, again, on that patient need and what they want for their recovery process.
Now, I understand that sometimes patients don't have, a home life to go to. They could be homeless or have addiction issues. What do you do then? Well,
we have, in the hospital, we have a lot of resources. We have a team of social workers that work hand in hand with our case management nurses. We identify early on that they might have housing needs, or addiction needs, or support needs at home. And we take time to listen to the patient, help them explore options they might not have thought of, and then hook them up with community. We have a small community, but we have a lot of resources, a very caring community, and we really appreciate that in our positions because we depend on the ability to reach out to connect people with our in-home services for addictions and folks who help with housing needs. We have wonderful shelters in the area, and so we work really hard with the patient and their families to come up with a very individualized discharge plan.
I can imagine that knowing that all of this is happening the moment you are, you get into the hospital can help with the healing. Having that peace of mind helps with getting better, doesn't it?
Absolutely. It's, when you going into the hospital can be a scary time. And then when you go home knowing that you're not at that level of independence that you were prior to whatever the procedure or what took you into the hospital. And so we work together and individually, I think, with the patient. It's really patient-centered care to see what they need to be successful, kind of put their fears in their mind at ease, and then connect them with the equipment or the services or resources to help them be at home, be successful, and be healthy.
And that's what it's all about.
Absolutely.
Being healthy.
Yeah.
All right, Jamie Truitt and Sherry Johnson, thank you so much, and thank you for what you do.
Yes,
to help
thank you.
people.